Overdoses can happen anywhere and to anyone. It's important that you're prepared to recognize and respond to an overdose. Using naloxone can...
We're in a drug poisoning crisis. People are dying. Like, this is as a public health crisis can get. Growing up in BC, I was aware of the drug poisoning crisis. I didn't live downtown. I live in a suburb, so I didn't learn too much about it because it wasn't a visible issue in my community. But when I, got a little bit older and actually was around situations where people, on public transportation, where people are using drugs or visiting downtown more and seeing people on the streets, I became more curious about the actual overdose crisis in our province. Learning that harm reduction is not just the implementation of safe injection sites or safe consumption sites, but the everyday conversations we have with each other about the level of toxicity of the drug supply, but also the tools available in our very own community pharmacies and health clinics that we can use to keep each other alive. So it's really empowered me to believe and prove that youth have such a massive role in health communication and health promotion, and that can start with a simple conversation about how to reduce our harms.
V stands for ventilate. Place the breathing mask from the naloxone kit over the person's face and give one
I
breath.
really started Naloxhome because I wanted to find a way to bring the same knowledge that I was able to learn through outreach and volunteering into community centers and secondary schools directly to equip younger people with the tools to prevent, recognize, and respond to overdoses. Because this is our leading cause of death, and we all need to be prepared to respond. There will always be some people who still see it as you're enabling substance use, which is so frustrating. But if students learn one thing during our workshop, even if they disagree with 99% of it, taking away one thing can help them save a life. So when we think about why people use drugs, we also have to look at what's causing them to reach for drugs in the first place. So many of these reasons are rooted in the social determinants of health. So unstable housing, lack of connection and family support, maybe limited income, lack of education, indigenous intergenerational trauma. Again, having these conversations, hopefully take some of the power out of the term addiction and substance use, and enables people to think that um these are just people who use drugs, not drug addicts. When you're riding a bike, your harm reduction's a helmet. When you're driving in a car, it's your seatbelt, sunscreen in the sun, all examples of harm reduction. So recognizing that so many folks have been dying due to our drug supply, harm reduction in a drug sense exists to keep these folks alive because of the high risk of toxicity. So this is fentanyl testing strips and safe consumption sites and naloxone kits. Our thing is going in, talking to them as youth. So not this is not a police officer coming in and saying, don't use drugs. This is not a parent begging kids not to use drugs or a teacher. We're their peers. We're not gonna get them in trouble. We don't even ask their names unless they volunteer them. We can answer their burning questions about substance use, but our job is to go in there, let them know the actual facts around the overdose crisis, how hard this is hitting our communities, where they can access support. We do naloxone training, so when we're in there, we teach students that every single person in the room is at risk of witnessing an overdose. None of us are exempt from that. It's our leading cause of death. And even just, talking students through trusting 911 and knowing that you're not going to get in trouble if you, call 911 in the event of an emergency. So reshaping narratives as peers is a model form of health promotion that I'm a big fan of. And it's been working. We've reached a lot of students with it, and it's pretty cool to see the impact of students picking up naloxone and better understanding the crisis. So many people, social determinants of health are not all met here. So equipping young people with the understanding of that and that just worldview going into their next stage of life is important because that will, I think, cause more of us to have increased empathy and increased compassion and understanding and awareness of what those of us around, this area are going through. It's really a combination of awareness, of education, of resources, and of actual systems being designed with youth at the forefront and youth at the decision-making tables.
Directly into the area at a 90-degree angle. Try to remove clothing from the area.
If I could pick, we would be mandated in every school district in the province. It would be a situation where students graduate and you talk to any other graduate in the province and they all know Naloxhome because they've all had a Naloxhome workshop. I want this to be drilled into the heads of all of our youth that, harm reduction exists. We're in an overdose crisis. This is why, but this is how you make a difference. Now, what I have hope for is that we're not just mobilizing this group of youth, but all of the youth we've reached. We're changing their narrative about why people use drugs and why we're in this crisis. And we're bringing awareness to the fact that some of these overarching social issues are just never discussed in school, besides maybe our workshop. So I have hope that in 10, 15 years from now, the youth who are learning through not just our workshop, but you know, seeing the injustices kind of play out the way they are now, they're going to be better decision makers than the decision makers we have today.
If you could say one thing to a young person struggling with substance use right now, what would it be?
Substance use is the least interesting thing about someone. It should not ever become their leading attribute, their label. With that, remember, there are people who care about you. You are human. There are service providers who want to help you. You are so much more than this. And I just hope that the connection and the comfort that substance use is bringing you as a young person, you are able to find in something else.
And remember, naloxone is free, naloxone is easy to carry, and naloxone saves lives. From your friends here at Naloxhome Society, stay safe.